Ms. Secretary Kennedy, you're listed as the chair of the commission. Did you read the report and fact-check its sources prior to publication?
All of the factual
Did you read the reports, and did you yourself fact-check them, sir?
I did not fact-check.
You did not fact-check. So why then, as has
all
been widely reported,
excuse
me, sir, I'm speaking. Why then did the report include citations to sources that don't even exist? How does that happen under your leadership, sir?
All of the foundational assertions in that report are accurate.
They did not exist. How can they be accurate if they did not exist, sir?
Some of the citations
in fact, my understanding is that even once the report was updated, more authors and researchers came forward stating that their research was misconstrued. This is quite unbelievable, sir. In fact, I was a pre-med at UCLA. They have a great pre-med program. If somebody turned this in as an undergrad to their professor at UCLA, they would have received an F, sir, an F for the misinterpretation, the falsehoods, the denials, and also citing references that don't even exist. That's lying and dishonest, sir. My concern here is that you and this administration are undertaking vast changes to our federal public health system and using purported facts and gold standard evidence that you claim to have as justifications for your decisions, actions, and frankly, your decimation of our nation's public health infrastructure. Yet, what you are relying upon isn't real. It isn't data-driven. And it isn't based in fact, science, or reality, sir. It's wrong.
That was Congressman Paul Ruiz, an actual physician, questioning RFK Jr., who cosplays as a physician but has no medical or public health training, but he does have a law degree. Not sure how far that gets you in the OR, but I'm assuming not very. But part of his Make America Healthy Again agenda was to release a MAHA report, which, of course, was stuffed with fake citations and made-up studies. I mean, you literally cannot make this stuff up. Although apparently they did. The MAHA report included at least 37 citations that appear multiple times, references with wrong authors, and several studies that don't exist at all. When the journalists at the outlet Notice started fact-checking the report's 522 footnotes, they discovered something truly extraordinary, that several citations referenced papers that didn't exist. Why? Because it was put together using AI. And how do we know that? Because some references included OAI site attached to URLs. That's a definitive sign that the research was collected using artificial intelligence. They used ChatGPT to write a federal health report and didn't even bother to check if all the studies cited were even real. One citation listed a December 2022 study published in JAMA Pediatrics on adolescent mental health that simply does not appear in the journal issue. The supposed first author, epidemiologist Catherine Keyes, confirmed that she never wrote any such paper. But the good news is that when confronted about this embarrassing mistake, the White House took responsibility and apologized for misleading the American people. I'm sorry, I couldn't even continue on with that. Carolyn Levitt pretended that it was a formatting issue.
A Notice investigation found that the Hallmark MAHA Commission report that was released last week cites studies that appear to not exist. We know that because in part we reached out to some of the listed authors who said that they didn't write the studies cited. So I want to ask, does the White House have confidence that the information coming from HHS can be trusted?
Yes, we have complete confidence in Secretary Kennedy and his team at HHS. I understand there were some formatting issues with the MAHA report that are being addressed, and the report will be updated, but it does not negate the substance of the report, which, as you know, is one of the most transformative health reports that has ever been released by the federal government, and is backed on good science that has never been recognized by the federal government.
And a quick follow-up, can you talk about what tools or research goes into production of these kinds of reports? For instance, is it AI that's used to put together these reports now?
I can't speak to that. I would defer you to the Department of Health and Human Services. What I know is just what I told you.
Does not negate the substance. The report was based on non-existent sources. There is no substance. A formatting issue is that the margins are too small or wide. Fabricating non-existent sources would probably get you kicked out of medical school. Perhaps we should learn the difference. And let's be clear about what happened next. hours later, an updated version of the Maha report was published on the White House's website with the fictitious citations initially flagged by the outlet Notice replaced with new references. They got caught red-handed using fake science, quietly tried to fix it, and then just hoped nobody would notice. But hey, most transparent White House in history, am I right? But here's the thing that really gets me. This isn't just some administrative screw-up. This is emblematic of why RFK Jr. should never have been given that job in the first place. He has a law degree, but again, is not a physician and has no medical training or public health training. Think about that for a second. The guy overseeing the CDC, FDA, NIH, Medicare, and Medicaid, agencies that literally determine life or death for millions of Americans, does not have any medical training whatsoever. The American Public Health Association stated that, quote, to effectively lead our nation's top health agency, a candidate should have proper training, management skills, temperament, and the trust of the public. Unfortunately, Mr. Kennedy fails on all fronts. As one expert put it, having Kennedy lead HHS is like having somebody who doesn't believe in gravity being the head of NASA, which I wouldn't put past this administration. This is a guy who has stated that there is no vaccine that is safe and effective and touted misinformation claiming that vaccines cause autism. He was literally identified in 2021 as a member of the Disinformation Dozen that produced 65% of the shares of anti-vaccine misinformation on social media platforms. And now he's in charge of the agency that approves and monitors vaccine safety. Let me ask you this. When you or your family members get sick, who do you want making important life decisions at your physician's office or in your hospital? Your doctors or Robert F. Kennedy Jr.? Because that's essentially what we are dealing with here. A conspiracy theorist with no medical background overseeing agencies that employ tens of thousands of actual scientists and doctors. And this fake citation scandal, it's not an accident. It is a feature. When you put someone in charge who fundamentally distrusts scientific institutions and believes in conspiracy theories over peer-reviewed research, of course they're going to end up citing made-up studies. This matters because these are real-life consequences. Kids could die from this kind of policy change. We're talking about somebody who could influence vaccine recommendations, food safety standards, and drug approvals, all while having zero medical expertise and a track record of spreading dangerous misinformation. And the scariest part, Kennedy's promised to fire 600 employees at the National Institutes of Health and replace them with 600 new employees. He wants to gut the very scientific expertise that could have prevented this embarrassing fake citation scandal in the first place. So let's call this what it is: a fundamentally unqualified conspiracy theorist using AI to generate fake science in order to justify policies that can endanger public health. And when he gets caught, he blames formatting issues and moves on like nothing happens. This is what happens when we put ideology over expertise, when we prioritize political loyalty over scientific competence. As one public health expert warned, Kennedy is not going to use science, and he's not going to do the hard work to make America healthy again. In fact, I think he's going to make America even more sick and distrustful of public health. The American people deserved better than this. We deserved an HHS secretary who believes in science, not one who literally cites fake studies to advance his anti-vax agenda. But this is what we get when Donald Trump decides to let RFK Jr. go wild on healthcare. Fabricated research, dangerous misinformation, and the systematic undermining of the very institutions that are supposed to be keeping us healthy and safe. Before you go, if you enjoyed this content and you want to see more and support independent media, please subscribe to this channel. The subscribe button will be right here on the screen. But second, the reality is that we are now in a political environment where this administration can lean on any of the social media platforms to suppress certain voices if they don't like critical coverage. That means my longevity here is in the hands of a few tech billionaires who are already making it clear that they are willing to cater to this administration. To that end, signing up for my newsletter is a way for me to reach you directly if that ever becomes necessary. I'll put the link right here on the screen as well, so please sign up. It's free, but there's also an option to do a paid subscription if you'd like to support me and my team. I really appreciate it. Thanks so much for watching.